they don't earn a living, as for this 57-year-old, just because he doesn't earn a living, watching TV the whole day is a very passive exercise. And I used to take food to my son because he would not come to the dining table to eat. I would put it on a tray. And take it to him. So that is real Raja style, you know. So it's not the child's fault. It's my fault. I put it on a tray and took it to him, right? I made him used to that. He's a very wonderful child. Wonderful. I can tell you that. And so it's my fault that I kept making a tray and giving it. It's totally my fault for making him so dependent on me. Correct? Very often, when people have mental illness, you are so happy that they have stopped screaming that you say, ठीक है यार, चलता है, पड़ा है ना, चिल्ला तो नहीं रहा है. But from there you have to slowly go to the next step to empower that person to think, to make decisions, to become a whole person again. Yeah. And one of the very important ways you can do that is leave books around on mental illness. There's a very good book which is in Help Library. Take the name down. It's called Change Your Brain, Change Your Life. Change Your Brain, Change Your Life. No, this book is good. I'll tell you why. Change Your Brain, Change Your Life by Dr. I forgot the surname. No. See, what it's showing, a lot of the problem with mental illness is you can't have a measure. But there are SPECT studies, S-P-E-C-T, SPECT studies, which are actually nuclear imaging. You have CAT scan and you have MRI, but CAT scan and MRI are giving you static images. The SPECT studies shows the fluid movement in the brain. Most of the mental illnesses are due to greater activity in the basal ganglia or greater activity in the prefrontal cortex, different illnesses. There will be more activity, and these can be seen in the SPECT studies. See, a person who has mental illness always questions you, do you have proof? Do you have proof? These SPECT studies actually give proof. Indian psychiatrists haven't had the habit of doing a SPECT, this thing and showing it to the patient. But this doctor has done SPECT and shown it to the patient where you can see the abnormal activity in a particular region. When you feel convinced about it, see, it's very human. I didn't have a SPECT study, I don't want a SPECT, I don't need one, but everybody is not like that. He is going to tell, do you have proof I am mad? Do you have proof? I am not mad. There is some hyperactivity in some parts of the brain which create some chemical imbalances, and just like you have a chemical imbalance of sugar, and that is being through the chemotherapy of taking medicines every day, those chemical imbalances are controlled. And so you have scientific proof through the SPECT studies, and this book is giving you hundreds of case studies of different types of psychiatric disorders, from depression to schizophrenia to panic disorder to everything, and he's written it in very simple English. So I would especially, I'll just show you the book down after we finish. I've forgotten the author. This is my own book, but I saw it down also. It's a good book for you to read or borrow, and the images are there. Because very often you are not able to get that person out of denial. One very important reason why I recovered was when my parents went abroad, they brought 6 or 7 books on mental illness. And it was all just lying around the house. So sometime or the other person picks up the book and reads. And slowly and steadily, especially if they are educated, they start realizing it's possible. Because denial is at the root of not taking your medication. Denial is at the root. Your ego. If I deny I have asthma, I won't take my asthma puff. Right? If I deny I have blood sugar, but I can show you my blood sugar. I can't show you the thing. But the SPECT studies actually can show you the movements in the brain. Yes, the circulation of activity in the brain, and you can see it. It's written there. It's proven, and it is a very useful book for you. Yes, you have a question? SP, the full form is, there's a full form of it, SPECT, there's a full form. I can bring the book up and share it with you at the end after we have tea. No, it's SPECT. SPECT. Yeah, it could be positron. Yeah, could be. But what he says in the book is that people use MRIs a lot. People use scans a lot for the brain imaging. But why he preferred to go for SPECT was his point that MRI gives the brain in a static form. The MRI imaging also shows some slight deviations in the shape of the brain. But these are very mild. You know, like the deviations and all are very mild. But in SPECT, what he said is you can see the movement of the activity in the brain. That was his point. And then later on they could develop better and better images also. So they could see it. Because the very thing is, when you have blood pressure, you can see it. When you have diabetes, you can see it. Again, if I tell you, show me codependency. See, these are
very abstract.
Yeah, it's not abstract. It is specific. There are certain lists of things which are happening repeatedly over a period of 6 months. And if it is so, it's a codependent relationship. Now, I had two choices. I don't give him food. So he calls up McDonald's and eats. Or I go and give him in a tray.
Who gives the money?
Exactly. Again, I'm giving it. So I have created the situation. That's what I'm telling you. So we are all doing it because we feel we have no choice. Because what? I love my son. I don't want him to be hungry. Right? It does come in. We are all human beings. Just because I'm talking to you about codependent relationship, it doesn't mean I'm a saint who's perfect. I'm only saying we have these situations because I came out of, I'll give you a very good example of how I was 43, 44 when I was a single mother with my daughter, and I was living with my parents. And I was a patient of schizophrenia. I was not yet relapsed, but I was in a very traumatic state. Right? After a few months, when I had a job, my parents said, now you're pretty big, you're 45, you move out. That really hurt me. Because I felt, why can't I stay with them? But they were right. You know why? Because when I moved out with my daughter, I became totally independent. Otherwise, their whole life, my father is 80, I'm 50, my mother is 76. I'm going to Delhi to look after my mother. Otherwise, we can say that, okay, you have mental illness, so you're not capable. Something is going to happen to you. No, you can have something called loving detachment. It does not mean that my parents did not love me. In fact, I thank them every day. They really, really loved me. Because they knew I could do it. They knew I could do it. Yeah. And you have to tell that person they can do it. Because you always have that feeling you can't do it. Even now, on some days, you won't believe it, I feel I can't do it. And then I just push myself. I say, no, I just have to leave this house. Leave this house means I have to have a bath, get ready and go out of the house just to even buy 2 vegetables. Because that kind of completely shakes me. No, I want to be at home. There's a lot of work to do at home.
Is that it produces the desired result. Because any medication you take, psychotropic drugs, it takes time for you to adjust, to adapt yourself to those drugs. Secondly, there are instances when different symptoms manifest. Like for some period of time you have one symptom that is prevalent. Hello? Yeah. So So sometimes there are some symptoms which are very predominant, and at times there are some other symptoms which are predominant. So accordingly, the dosage when one visits the psychiatrist